for today.
Good morning. My name is Ralf Friedrichs. I'm an addiction recovery coach, a life coach, and author, and the host of this show, To Take Your Life Back Today radio show. You can also see a video version of this if you go to YouTube under channel Take Your Life Back Today show. Folks, coronavirus's top targets: men, seniors, and smokers. Men, seniors, and smokers. Viruses can strike one group more severely than another. The 1918 flu, which claimed 50 million lives worldwide, particularly affected young adults. The Zika outbreak that raged through Brazil 2015 to 16 had a especially devastating effect on pregnant women, attacking the brains of the fetuses they carried. COVID-19, otherwise known as coronavirus, the disease caused by new coronavirus that originated in China, appears to get more dangerous with age, says Michael Mina, MD and assistant professor at Harvard University. Folks, there seems to be this threshold. Below age 35, we're seeing practically zero cases, he says. As people increase in age from their 40s to 80s, they're seeing mortality increase. The virus, which erupted late last year, now counts more than 80,000 cases and 2,700 deaths, which is up even more right now, the majority of them in China. A study published Monday in the Journal of American Medical Association that examined the first 45,000 cases in China found that 80% of the reported cases appeared to be mild. The other 20% of those diagnosed had moderate, severe, or critical symptoms, including a hard time breathing, pneumonia, and organ failure. About 2.3% of overall infections have been lethal. Severe acute respiratory syndrome, otherwise known as SARS, a similar virus that started in China in 2002, also hit people over 60 the hardest. More than 80,000 people contracted the virus over 8 months, nearly 10% of whom died. With COVID-19, so far ages 1 through 9 account for just 1% of all Chinese infections, and none of the deaths, according to the JAMA study. Another 1% of ages 10 through 19 of the people in their 70s who got the virus, 8% died, the study found, along with nearly 15% of those 80 and older. Someone in their 80s has a pretty high risk of not leaving the hospital if treated for COVID-19, the doctor says. Early data suggests that men are more vulnerable, as they accounted for just more than half of the cases, according to the Chinese Center for Disease Control and Prevention. Infected men died twice as often as infected women. Mina says the men might account for more than cases because they were tested more often, but the evidence is not strong to make any good conclusions. It is possible, several experts told the New York Times, that because Chinese men are more likely than women to be smokers, that they could be hit harder than women. A World Health Organization study from 2019 found that 47% of Chinese men smoke compared to 1.8% of Chinese women. Women who generally mount strong immune responses than men in general. People with heart problems, diabetes, or lung issues like COPD are also at a higher risk for severe disease and death, says Dr. Marazzo, Director of Division of Infection and Disease at the University of Alabama at Birmingham School of Medicine. She compared COVID-19 to viral pneumonias, which tend to have a worse effect on people who already have weakened immune system. Protection for babies. Alert, protection for babies. Pregnant women do not seem to be impacted by this infection, though only a few have been carefully tracked so far. One study published recently in the Lancet found that 9 women who became infected with COVID-19 did not pass the virus on to their babies, and Mina says that the newborns seem to be spared the worst of the disease. I think the numbers of young babies who have died have been extraordinarily small, compared to the number that have probably been exposed, he says. We're just not seeing clinical illnesses at this point. Scientists don't know why children seem to be protected, even though, as any parent knows, they are usually a carrier of disease. It could be that children's bodies are better able to handle the effects of the virus says the doctor. Or perhaps they have immunity from a previous related viral infection, or the virus doesn't replicate as well in them for whatever reason there might be. Healthcare workers also appear to be at particular high risk. At least 1,700 have become infected while treating patients in China, most in Hubei province where the outbreak began. Overall, 15% of cases among health workers were classified as severe or critical, and 5 have died, including Li Wenlang, a 34-year-old Chinese ophthalmologist who tried to raise an early warning about the disease way back then. Trying to help getting sick. Healthcare workers are likely to be particularly vulnerable, according to Mina, either because they do not realize the person they treated was infected, did not wear protective gear perfectly with every one of the dozens of patients they treated, or because they were exposed when they thought they were really safe, such as dormitories where they slept. Being run down from a fight didn't help either with all the hours, kind of like the job that I do. Constantly at my job place, more there than home lately. The doctor says she's particularly concerned about the previously health care workers who are falling ill and dying. It's possible they are sicker than the average people because they have been exposed to patients with extremely high viral loads. Adding that she is concerned that the data from China may not be telling the full story about these particular workers, that it's somehow not the exact story. To be prepared, the doctor says, people should keep up with news about where the virus is spreading and take the usual precautions to keep themselves as healthy as possible, although it's spreading throughout the United States and the world. Getting enough rest, exercising, eating well, and getting the flu vaccine is a plus. Also, to be sure you're in good shape to withstand an infection is even more important now. We know that people who are generally healthier, not smoking, getting their vaccines, the boring preventive health kind of stuff, those are the people who do the best when they go to the hospital for surgery. They recover the quickest from surgery. Friends, I thought I heard a call. Rather than focusing on so much on trying to quarantine and prevent this from spreading, it's going to spread. All effort needs to be on what we can do best to prepare. This came from Dr. Mina, the doctor from Harvard University. Mina, what the doctor says here is that if we're 65 or older, we wouldn't do any foreign travel that wasn't absolutely needed right now, out of pure abundance of caution. So be careful. If it's totally just for fun, it's not a horrible idea to cancel or postpone a foreign trip, even if it's business related. Your health, your life is more important. He says it's also better for people who aren't feeling well to stay home from work and self-quarantine themselves to avoid passing the illness on to other people, nor do you want them to pass it on to you. The doctor says he agrees with the U.S. CDC that the COVID-19 virus is likely to hit this country more heavily than it has and spread through the communities, even yours possibly. So, it may, in fact, already be here in your community. The CDC has been relying on its flu detection system to pick up any cases of COVID-19, but he is not convinced that works well enough because it is all over the place. You can see it's spreading. It's like a wildfire. Knowing who is most vulnerable to the disease can help communities respond better if and when the virus arrived. For instance, an 80-year-old with a lung condition should be treated aggressively from the start if they come down with the virus rather than waiting until their condition worsens. Got to nip it in the bud. The doctor says he would like to see a home-based test, like a pregnancy test, where people can tell if they are infected or not, without going to the hospital or clinic and risk spreading COVID-19 any further. So, with that said, he says he is also concerned that the U.S. hasn't prepared enough for the virus to spread across the country as he expects it will do at some point or another. And we're seeing that. Rather than focusing so much on trying to quarantine and prevent this from spreading, it's going to spread. All effort needs to be on what we can do to the best of our abilities to prepare for this epidemic. 80 and over, stay home. Before then, only go out. Any ages before that, only go out if you need to. Call me at 844-405-HELP. Together we can help each other, take our lives back. Be good to yourself. Always be good to each other. At times, especially now, but always, it's so good and relieving to count on God. Reach out, dig deep within your faith, and pray, not just for yourself and your loved ones, but pray for people around you. We are all in this together. It's not you or me, it's us. It's us fighting this epidemic. We